Right, I think we're live. Sorry, we're a few minutes late, guys.
Hi there.
Hello everyone. Sorry, we're a few minutes late. We thought we'd just introduce ourselves and then we'll get going. My name's Sophie White. I run veterinary behaviour support.
My name's Charlie Edmonds. I run the London Vet Behaviour Clinic based in Greater London.
So thanks for all spending your time to come and see us and listen this evening. We really appreciate it. So we were going to be talking about how to handle difficult dogs in practice. And we thought that maybe that is where we'd start, is that terminology around these dogs. And I know that they're really, really tricky to handle, and they do feel very difficult to handle in practice. But ultimately they're having a really, really crap time, and they're not just trying to be difficult.
These dogs just can't cope at this moment, and it's about understanding that. So rather than seeing them as sort of a difficult dog, it's sort of how can we help these dogs and why are they struggling in that moment, and why are they being difficult.
And because ultimately, probably the most common underlying emotions that are going on with these patients are fear and frustration, and quite commonly a mix of the two. I think we can probably all appreciate that the vet clinic can be quite scary. But also it's really frustrating because you can't escape. Most dogs' coping mechanism for fear is running away, moving away. And we can't always, we can't just let them do that a lot of the time, so it can become really frustrating as well, and frustration in itself can lead to quite intense emotional outbursts and aggressive outbursts.
Mm-hmm. Absolutely. So the way which we've sort of thought about really splitting this up and working of how to sort of deal with those challenging cases is to think about what are we going to do before they've come in, what are we going to do during the visit, and what can we do after it. So the main thing really with any of these things is by failing to prepare, you're failing to fail, so preparing to fail. So we want to make sure that we set ourselves up to succeed at doing it and making sure that it's as easy for the animal as possible. So the first thing which we should do is really to contact the client before they come in to find out a little bit more about the case if we don't know it, but also to work out what's we need to do and what would be nice to do, whether they like any treats or toys, so we can start to work our consultation around that, and then whether any medication's been used previously and whether the owner's open to using medication if we need to.
And I think, like Charlie was saying, we really have to make a plan, and we need to know the plan ourselves. And what we need to steer away from is the mentality of let's just get it done, and sometimes that is the plan. People just think, right, we're just going to get it done however we need to do it, and that's really not the way we should be going. It's not sustainable in the long term, because those dogs will get worse. If they have a stressful experience, they're going to be worse the next time. So although it's tempting to sort of for that short-term benefit of just whiz through this consult, in the long term it's going to make it much harder, and it's actually also going to make it much more dangerous, because for your colleagues and things in the future that deal with that dog, if we continually expose them to very aversive situations, excessive restraint, those sort of events, they're going to become more and more reactive. They're probably going to become more aggressive. So we need to look at how can we create a plan that's going to help us in the long run.
Mm-hmm.
And I know one of the questions that came through before was, how do we try and prevent problems? And essentially it's by following kind of the flow that we're going to talk through, because we want to try and minimize the aversive situations we put the dogs in. Many dogs already have issues at the vets, and to be totally honest, dealing with those problems in clinic is very, very difficult, because those dogs are normally what we would say are over threshold as soon as they arrive. So if as soon as they step out the car, they are already barking, lunging, trying to run away, it's going to be really difficult to work with those dogs in practice. But that doesn't mean we can't help them. It just means we probably need to be giving the owners things to do at home. We probably need to be involving behaviour and training professionals to put groundwork in at home before they then come back to us. And then we follow the system that we're going to talk through.
Absolutely. And I think it's about sort of preparing the client for what we're going to be able to do and making them aware of sort of, okay, well, what we're going to try and do is all of these things we've talked about, but if we can't do that, then we'll have to book in for another day. And making sure that you set realistic expectations. Don't say, oh, you know what, we're going to be able to do this nail trim, or we're going to be able to get these bloods today. Don't worry, we'll sort it out. Because that's unrealistic. And it also puts that animal's mental health at risk and the welfare in that state. So it's better to sort of set yourself up for success and be saying, we're going to do everything which we can do. We might need to adjust medication, or we might need to use medication. We are going to work at your dog's pace. We're going to listen to them so that we make sure this is as positive as we can for them, rather than just getting things done.
I also think it's really important to involve the owners as well in terms of thinking about risk and decision making. So we're going to talk through in a minute about some drug options and things. And realistically, some of these dogs you are not going to have examined. You're not going to listen to their chests. You're not going to have done much with them before you give them medication. And sometimes, you know, people worry that we can't be sedating dogs we haven't examined, it's not safe. That needs to be discussed with the owners, because they are more than capable for taking on educated risks. If we explain to them why we think sedation is still beneficial, and we explain to them, you know, what the potential risks are, a lot of clients are still going to go for that over their dogs having a really traumatic time, because in the long run that's going to be bad for their welfare, because they're not going to be able to access any vet care if you can't even get your hands on them. So don't worry too much about sort of the fear factor of, well, I haven't even examined these dogs. Have an honest discussion with the owner, and like Charlie was saying, set realistic expectations. And I would really encourage you to focus on that need to do, nice to do. And what we mean by that is, you know, what is the absolute main purpose of this visit, and does it need to be done today? So like with your boosters, maybe, if we know this dog has got a very limited time span before it can't cope and it needs to get out, I will quite often, if I already know this dog and I know I can handle it to a degree, I'll quite often vaccinate it and then look at, can I actually do any physical exam on top of this? As long as the owners obviously have said, you know, the dog's generally well.
And it's a thing of sort of, yeah, not stressing them out if there's things which just aren't really going to benefit in that circumstances. So let's say if you've got a dog that's come in and it's really sort of worried about this whole situation, and it might be using some aggressive behaviour to try to increase some distance between you, you have to think, actually, is a temperature in this point going to be that, is it going to add that much to what my clinical decision is going to be? Or can I discuss with the owner that I haven't done this because I don't want to stress your dog out further, rather than making the situation worse? So it's about sort of looking at the whole situation and managing it, and being honest with the owner as well.
Yeah, and really just got to be flexible with your approach. It's not that dissimilar to maybe your clients that don't have enough money. You know, maybe if you've got your gold standard but your clients can't afford it, it's not that dissimilar, in as much as you might have your gold standard, but if your patient can't tolerate that, then you can't do it. You've got to do the best you can with the situation that you're presented with. And so when we're talking about this pre-visit situation, like we've said, you know, we need to prep the owner, we need to make sure we've got a plan. We also need to make sure we've got enough time, at least 30 minutes for slots for dogs that you know are going to be challenging. And think about what their problems are. If you know you've got a dog who doesn't like other dogs, make sure you've got a route in, make sure you're using a room that's not next to the kennels with the dogs barking. if they are stranger reactive, make sure they're not coming into the reception, so they're already having a stressful time before you've even got to them.
Mm-hmm. So one of the things which we're going to refer to a little bit is an algorithm which was done by Clean Cook over in America, which sort of briefly just describes sort of how to assess a dog and certain triggers which can cause a dog to be more reactive. And so, for instance, is it going to be better for it to wait outside, or is it going to be better for this dog to be okay sitting in the waiting room? And like Sophie said, choosing your route. Does it like to be examined on the floor, on the table? Taking into all of those things into consideration whilst we're looking at getting the animal into the room before we even got our hands on them. Those things into consideration whilst we.
Sorry, that was me playing back. I do apologise. I was trying to read your question. Someone's asked a question, but I'll see if Rosie can message it through to me, because my technology failed there. You don't want to have to listen to yourselves back.
All right, so one of the things which I think is quite important to touch on, which is often forgot about, is the role of reception and your front of house staff, and how important and incremental they really are. They are someone who will potentially make something be a success or a failure through how they book it. So if you've got a dog which is nervous or has issues maybe with sort of getting frustrated with having to wait, then make sure that you book them in first thing in the day or just after lunch, and provide some gaps so that other dogs aren't going to be around or they wait outside. But having a reception team who understand those needs and can discuss that with you is really important, but also because they can flag, oh, I think this dog might need some medication prior to that.
Yeah, and sorry, I was just keeping on questions coming in as well. So we're going to have a talk about drug options, because someone was saying, what do we do when owners just aren't on board and putting the work in? And that is really difficult. I think, you've got to stress to them the fact that you cannot provide good quality care to an animal that you cannot examine. And if they put the work in at home, you will be able to provide better care for them. But if they're really not up for it, then yes, you may just need to keep using medications, and so we're going to talk through those options, but you might just need to keep doing that. And it is frustrating, but sometimes owner limitations are frustrating, and I still think you just got to do what you need to do to make sure you can provide the best you can in the circumstances for that patient. Also, someone asking about owners being allowed inside, and one of the things we were going to say was, in non-COVID times, use your owner. Your owner has a relationship with that dog. Try and get the owners involved. Obviously, that's not possible at the moment, but a lot of practices are already doing sort of a mini phone consult first. I know some of the places I locum at, we call owners in the car and talk first anyway. So just make sure you're having these conversations ahead of time, so you're not trying to communicate through PPE while the dog's barking. Get prepped ahead of time, and then we're going to talk through how to progress things in terms of how we actually deal with it when the dogs are with us. So we've set our environment up right. I think we'll probably pop back and talk about pre-visit pharmaceuticals, so PVPs, a little bit later when we talk about some of our injectable options. But if we know dogs have got a problem, then they may well have had some of these drugs beforehand. But if this is just this consult's booked in the first time you're seeing them, they might not have had any drugs yet, which is okay. So we've got a good time slot, and our owners are prepped about what's happening. They understand the plan. They know that they're meant to be staying in the car, or they know exactly what they're doing, so the dog isn't out the car getting stressed before you've even got there. And in terms of when we're now onto our visit section, we need to make sure that, so the owners understand the plan. And one area I'd really encourage you to consider is making sure you've got express consent, because we have more and more owners who are very aware of their dog's issues at the vets and are trying their best to put work in at home. And there may be things that we would do in practice that will be really detrimental to their training, and understandably really upset owners if they know these happen. So just things like maybe restraining dogs in lateral to take temperatures, or to get blood tests. Personally, for me, I wouldn't be happy with that. I would be really angry about that if I was not aware that that level of control was going to be used. So I think we need to have that conversation with owners beforehand of how much do you want us to do to enable us to do these procedures.
And I think also at that point it's a good chance to discuss with owners. I don't think that's going to be appropriate if you think that, oh, I don't care today, I want you to trim the dog's nails or do those things. It's not, we need to put our patients first and understand that actually it's unacceptable to hold an animal down if it's really struggling and having its nails done. We want to make it a positive experience because, like Sophie said, we can do things quickly, but then what happens is next time when they come in, it's going to be more difficult. The animal's going to be have a much worse time and be more nervous about the situation, and more likely to show sort of aggressive behaviours. So it's important to set expectations, but also understand what the client is happy with us doing.
And when we were talking about this before, Charlie and I both said we have both refused to do kennel cough vaccines on dogs before, having tried, and the dog is too distressed. And yes, clients are not always happy, but there are things that clients might ask you to do that you would say no to. You know, you wouldn't routinely take dew claws off just because they want them off. You don't crop ears because they want them done, because we know those things aren't right. And for non-essential procedures, if that dog is really distressed, it's not appropriate. And I think we just need to have the confidence to say, actually, in my professional opinion, this isn't right.
Mm-hmm.
So when we look in terms of the actual exam and how we're going to get these dogs in, it's all going to be different, I know, depending on what your restrictions are at work at the moment with COVID. But the first stage is going to be a distance exam. You can get lots of information from a distance exam. I certainly have had patients that I have never actually managed to touch conscious. It's just been distance and then they're unconscious. And think about your initial reactions. You know, it might be very clear from the off that this dog is not going to let you approach. You know, is it actually safe for you to get, you know, within 2 meters of that dog, or is it really, really reacting? Mm-hmm. If it is safe to sort of approach, then I think obviously keeping at your COVID distances and stuff at the moment, but crouching down side on at a good distance, and just chatting to the owner. Don't sort of stare at the dog, reach out, try and interact with the dog. Just crouch down at a distance, say side on, so you're very non-confrontational. Have a chat with the owner, maybe toss some treats towards the dog, but not with your focus on them. And for me, I always keep like a 5-minute limit. If that dog is not going to make friends with me in 5 minutes, I stop, because I'm probably the scary thing, and there's no point me keep scaring that dog thinking that I might be able to develop a relationship.
And I think that's a really good sort of frame of time to work with, because you're just allowing the dog to show sort of how it's feeling in that circumstance and trying to build a relationship with it. And if after the first 5 minutes you're not getting anywhere, or if the dog's becoming more and more worked up, then we need to change our plan. What can we do to make it easier for this animal? Is it a case of actually it needs to be examined somewhere else, or do we just need to do this at another time when it's got some pharmaceuticals on board to help it in that circumstance?
So we were saying, you know, really, if that dog is choosing to interact with you, if it's coming up and it's, even if it's not necessarily thrilled about being stroked, if it's coming up and it's sniffing and it's exploring and it's not showing signs of overt aggression, if it's taking treats, I say ideally you've asked your owners to bring their absolute favourite that you know they eat at home. If they're interested in maybe playing with a tennis ball, fantastic. Let's get that dog inside and let's just take it really slow and see how we get on with our exam, and focusing on getting those need to do's done first. Mm-hmm. If we're not getting anywhere, then we need to decide, is this a today job? And if we have to do it today, those are really, are we talking about our real genuine emergencies? Because when we look at what we're going to need to do, that's a really scary experience. Essentially, we need to IM inject these dogs to sedate them, to be able to examine them.
Mm-hmm. And it should be seen as a true emergency that you need to do those things, because actually, yes, we can do that, but what's going to happen is it's going to undo a lot of good work, potentially by our colleagues, or by the owner, of getting the animal to come in to be comfortable in that situation, or be a little bit more comfortable in that situation. So see whether you believe it is a true emergency. Is it a GDV? Is it a foreign body suspected? Has it got something which is threatening its life and needs to be done? Versus, is it something that we want to do but potentially could wait till tomorrow with some analgesia or the start of some antibiotics?
Yeah, so what we'll do is we'll split things off now. Maybe if we leave maybe these pre-visit pharmaceutical dogs for a second. So these are the dogs which we decide, actually, this is a booster and it doesn't need to be done today. So we're going to send you home and we're going to give you some drugs, and then we're going to come back and try again. But let's maybe focus today on these dogs, like you should say, like maybe this is a shepherd that's been retching unproductively and you are really suspicious it's got a GDV, but it is still flying at you.
Mm-hmm.
Now, you can't leave that dog and it can't go home and take some meds and come back. So we look at how we're going to approach that. And for me, it's looking at minimizing the stresses, and you are probably one of those stresses. So we need to maintain safety. If we can get a muzzle on, that is obviously going to be ideal. And we need to make sure that it's tight and it's on. If we can't, obviously with your shepherd types, this isn't going to apply, but if you've got a smaller dog, you can maybe use gauntlets, towel wraps, something that's just going to keep you safe for a very short period of time to enable you to get an IM injection in. You can also look at using, sorry, Charlie.
I was going to say towels are really good, especially with things like Frenchies and pugs like that. You can get a good sort of wrap around their shoulders and allows sort of a safe restraint as such. So yeah, don't feel afraid to utilise some of the simpler things rather than feeling like you have to reach for some more extreme things.
Buster collars can work really well as well. If you've got a pre-made up cone that if you can just shove it on, then that's a great buffer, because these Frenchies and a lot of these shorter haired dogs are not going to be able to bite you from out, with a Buster collar on. So it gives you a good little bit of protection, but it's for a very short period of time. You can also use create like a crush, so as in terms of like a large animal crush cage for cats, etc. There isn't really an option for dogs, so you can sort of create those. So you can use things like your kennel doors, just using those to actually just stop the dog swinging around, because you may have someone holding the head end. If you've got a big dog who's jumping around, it can be really difficult to get an injection in. So just using that as a barrier, just to stop that swinging everywhere and keep them still for a second. And what I tend to always do is just have a quick scratch on the area, pinch the skin first with my nails, and then get the injection in, so they know what's coming. We both said, actually, we both go for back of the thigh. I think it's a better tolerated area personally, particularly because you're probably going to be injecting quite quick. You're not going to get a huge opportunity for this. You need to be speedy.
Mm-hmm. Yeah, absolutely. Don't wait around, just get it in and make it as stress-free for them as possible.
Now, we both actually use slightly different drugs, and that's fine. Ultimately, you need to use sedation that you're comfortable with. I think the only key things we really said were, don't go conservative, because these dogs are stressed, and if you don't sedate them enough the first time, it's going to be much harder when you start trying to top up. So obviously within safe limits, but go to the top end of what you're comfortable with. And what I would say is, don't use ACP. There is no reason to be using ACP. It's not anxiolytic, it's just sedative, so you're not going to make them feel any better. It's actually not a very strong sedative. If you're giving enough ACP to make your dog properly sedated, that's probably not a very safe option. And there is also some evidence, at least anecdotal, I've experienced it personally, using ACP and having disinhibition of aggression. Mm-hmm. So essentially your dog becomes a lot more overtly aggressive.
Mm-hmm. So yeah, probably one to stay away from. What do you use, Sophie, just out of interest?
I tend to use methadone and dexmedetomidine if I can. I just think it gives you a quite quick and a really deep sedation. But I also think that it's useful because whatever you do, the dog's not going to wake up feeling uncomfortable. Because there might be things that we don't think are that bad, but if we're clipping nails and maybe we catch quicks, or if we're examining their ears and their ears are sore, I just don't want them to wake up and feel uncomfortable and add to the unpleasant experience. And methadone, you know, is pretty safe. I'd rather give more pain relief than I needed, but that's the same. That's my personal choice. And I know you use something a bit different.
Yeah, I mean, no one ever complained about having too much pain relief, eh? So I think absolutely, definitely do that. And I think it's about assessing the case in front of you. So if it's something that is going to be non-painful, then I will use quite a high dose of Dom and Tor. And then if I need to top up, I'll add in ketamine. But if it is going to be something which is painful, let's say I've got an aggressive dog which is a really bad ear infection which has now got a head tilt and we need to look in its ear. In that case, I will use methadone because me looking inside its ear is going to be very painful. So Torb is not going to be enough. So assess the patient in front of you to make sure that you choose the right drugs. But more importantly, use drugs which you feel confident with and you use on a regular basis because you're going to be better at handling those situations and you're going to have a knowledge about how to utilize them.
And what I would say is please don't be afraid to anaesthetize patients. If, for example, you're sedating a dog for a groom, if that dog is aware of what you're doing, if it is growling at you under its sedation, you need to stop and you need to make sure that dog is not aware, because it is a very, very scary experience knowing something scary is happening to you and not being able to move or do anything about it. Mm-hmm. And if they're growling, they know what's happening because sedated and anaesthetized patients don't growl.
Yep.
So, you know, they know. So if you do start doing things and the dog is clearly still not happy under sedation, just go heavier, go deeper, anaesthetize, because you don't want to teach that animal that the vet is a really scary place. So we've talked, so that's kind of, you know, that's how we're going to deal with our actual dogs that we need to do stuff with on the day. And then when we're looking at post-visit, so how are we going to wrap this up? I would always try and end on a positive. Even if the dog is like not been happy with me the whole visit and really doesn't like me, I will still try and convince it to eat some cheese or offer it something really nice before it goes. And some of them will take it on the way out. I think they sort of have that awareness that this trip is over. I might as well have a tasty treat on the way out. But yeah, any opportunity you can, try and make it a bit better.
We talked about them leaving with a little party bag, try to make it a little bit better to remember the situation isn't all bad. So yeah, even if they're not taking that reinforcement at that moment, try and make sure that it's as positive in any way which you can do.
Yeah, and an owner debrief. Please be honest with the owner. If the dog has bitten somebody, don't be embarrassed. If it's tried to bite somebody, don't be embarrassed. You need to tell the owner about that. You need to tell them what you've done or maybe what you couldn't do and why you couldn't do it. And I think that's going to give strength again to your argument of, you know, you need to do some work with this dog at home. So like muzzle training, for example, if it was really stressful or you really couldn't get a muzzle on and you just weren't able to do anything with that dog, then I think, you know, you need to say to the owners, you know, you have to do some work with this because we cannot safely deal with your dog. And that's not a reflection on that dog's, you know, character or worth or anything else, but there has to be some safety things in place. I know the APVC have a handout about how to start muzzle training. So that's a really good one to use with owners. I think Rosie's going to pop that in the comments for you guys to keep, but maybe have some printed out and give those out to clients. Muzzle training isn't difficult, but it does take time and they need to be done at home.
And it shouldn't be So it's something which you need to take that time in to build that positive association, to make sure that it's a coping device for that dog when it comes in and it feels less stressed rather than more stressed. So it's not just a device to act as a safety mechanism. It's much more than that.
Yeah, and I think what would be ideal if all dogs are muzzle trained, but convincing owners to do that is tricky. But as you say, yeah, muzzle training is a really helpful skill for dogs to have. Also in our owner debrief, what we're probably going to talk about is the fact that next time we might need to use drugs before they come in. We couldn't do anything today without knocking them out. Let's plan ahead. So this maybe brings us back to those dogs that maybe we sent home and said come back in a few days. What drugs are we going to send them home with? And I think there's sort of the main categories. Maybe the less commonly used one is I do sometimes use Xanax, so alprazolam, but it doesn't give you sedation. So you do need to be aware of that. So I might use that with dogs who maybe allow some exam, but then when you start to do maybe certain things, they really panic and then they just can't take any more after that. So I will sometimes use Xanax in those situations. But probably more commonly used are gabapentin and trazodone. A lot of people use them together. I wouldn't use gabapentin on its own because it's not going to give you a huge result. You might want to use trazodone on its own, that's fine. But they do work together really well. The dose rates that are often stated are about 10 to 40 mg per kg for gabapentin and about 3 to 10 mg per kg for trazodone. Again, just think about the case and any comorbidities or anything, but I'd probably be going towards the upper end on the trazodone. You probably don't need to be going that high on the gabapentin because it's only really just going to be giving you that little extra oomph. But I personally like doing the loading doses. They sometimes get mentioned, so doing a loading dose the night before and a loading dose a repeat dose about 90 minutes before the appointment.
So I think with that, I agree with Sophie. With the trazodone, there was I don't know what you call it, sort of a presentation at the Veterinary Behaviour Symposium last year, where someone talked about using trazodone 90 minutes prior to a consultation at a dose 9 to 13 mg, so a little bit higher, and found that to be a good anxiolytic and showed less sort of anxious behaviours related or fearful behaviours in the clinic. So that's what I tend to use as my first protocol. Is like, okay, they can go home with that. If that's not helped, or if they need a little bit more, then I personally will then add in the gabapentin with the trazodone, and sometimes, like Sophie said, start the night before to help. But they work very well together, those two. And there is talk of a sort of a bad dog cocktail, which people often use, which is similar but also contains ACP, which neither of us advocate.
No, and I think some people also use things like Cilio. Firstly, it's really expensive, which I know that can't be our deciding factor, but you're using it off license anyway because it's not licensed for this purpose. It's very expensive for this purpose. That's not going to get your owners to be that keen to use it regularly before every visit. And it's anxiolytic. It should not be sedative. If your Cilio is sedative, you're massively overdosing. And essentially, you're just giving them dexmedetomidine, which if you then want to inject them IM, you need to think about the fact they've already had dexmedetomidine. So I wouldn't use Cilio. I think it's just not, it's not what it's made for. And I think you have got other drugs that do have safety data. Yes, they are off license, but there are recognized safe dosing ranges. So personally, I'd be going towards those rather than trying to repurpose your licensed products. Mm-hmm. And I know we've gone over time a little bit, but I thought the last bit, which is really key, is do good notes. Do yourself, because you probably won't remember, unless it's marked in your memory, but you probably won't remember, but your colleagues are definitely not going to know how it's gone next time. So what worked? What does the dog like? What doesn't it like? Does it is it fine unless you touch its feet? Or, you know, does it really not like men, or it really doesn't like you wearing green console tops? What does it actually like and not like? Because there's all well and good saying it's an aggressive dog that's likely to bite you, but those dogs have triggers, and the more you understand those triggers, the more you can avoid them and minimize risk.
Yeah, absolutely. It's just so important not to just put care or aggressive dog. That's just not useful. All it does is give the next clinician anxiety, and potentially, if they're not that savvy with behaviour, handle the dog inappropriately and make things worse. So it's much better just to try and just spend an extra 5 minutes, just using some time just to be specific about what has worked, what hasn't worked, and what are the triggers, if there are triggers with that dog.
And drugs, you know, did they have pre-visit pharmaceuticals? How did it work? What doses were used? What have you suggested to the owner for next time? Have you sent them away with another dose ready for when they need to come in next time? You know, what injectables did you use? I'd also encourage you to weigh your dogs while they're sedated, because you probably won't be able to get them on, you may not be able to get them on the scales conscious. And if you've got a weight up to date on your file, it's going to make it much easier for next time when you need to get your drugs ready. So think ahead. And the other thing I would say is, if we do have a dog that has actually bitten, either in practice or in the domestic environment, don't be embarrassed about talking about it, but we need details, because we need to understand risk levels, because you're going to deal with those dogs differently. For example, you know, if you've got a dog that's just snaps and maybe makes contact and leaves a red mark, yes, you're probably going to try and get a muzzle on. You're going to try and do a little bit more hands-on if you really, really need to. But if we've got a dog that's got a serious bite history, we still have a duty of care to those dogs. We need to make sure we're providing for them, but we need to make sure we're doing that in a safe way. And we can't do that if we don't understand what their risks are. So we need to have really honest discussions with owners, and as they make sure we relay information from the clinic really honestly to owners as well, so that we can plan ahead and we can all be really informed of what's actually going on with these dogs.
Yeah, totally agree with that. And I think, just to finish off, someone had asked about what you can do to help with the reactive dogs which are becoming stressed when they come into the clinic and stop that from happening. And I think that's a case of being able to, if you've seen them prior to that, then it's medication that might help, and then you can start to do that desensitizing process where possible, where they can come in and have a positive experience and not be handled and it not be a stressful event, or just finding the right medication to help in those circumstances. So we talked about sort of trazodone, gabapentin, but with some sort of reactive dogs, clonidine also can be quite useful pre-visit. So that's just another one to add. But if you want to have a chat with either Sophie or I about any of those doses, or about the medication, just get in touch.
Yeah, and I think probably final thing from me, so I was just going to say about desensitizing them. I know lots of people really try and do vet friendlies and things, but if the dog is stressed during those experiences, you're not making it better. You might actually be making it worse. And I know that's really difficult, because no one does that wanting to make it worse. But if the dog just cannot cope in the vet environment to be able to do any learning, that's where you really need to be getting people to be doing work at home and getting a behaviourist and trainer involved to try and help support them outside of the vet clinic.
Absolutely. It's not just the nervous dog, it's the dog which is boisterous and overexcited and can't cope in those situations. So don't necessarily think the dogs that are the ones that are difficult or aren't coping are just aggressive. It's far bigger picture than that.
Yeah, and they just need support. And it's like there's only so much you can do in practice, because ultimately they're in that scary situation then, and it is really tricky. So you can minimize making it worse, and you can try and minimize the risk of problems developing, but once they're there, you just have to deal with what you've got and try and encourage the owners to do work at home, to try and improve the overall situation. I don't think we've had any more questions through. I don't know, Rosie, if you've had any come up.
Something which you need to take.
Sorry.
Cool. I think that's it from us. So if you have any other questions or anything, please leave it in the comments and we can get back to you through that or through the website.
I think I might have a couple. Hang on one second. I'm just going to open my Facebook. Apologies. I think you're going to hear the video back. Let me just mute myself a second and then I can just double check if there's any. No, I think we've covered the main questions. I think were about owners and things, and I think, you know, we've mainly covered what we can on there. So yeah, if anyone does have any questions that you still really want to ask, do pop them in the comments. And you know, Rosie said that she can pop one of us on as admin so we can type back and answer and stuff over the next sort of couple of days if you do need anything extra. But I hope this evening has been helpful for you all. And yeah, just remember, they're not trying to be mean, they're not trying to make your day more stressful, although I know they often do. But yeah, the more you try and empathize, and the more time you take, it will get easier in the long run.
Absolutely.
Right, thanks very much, guys.